Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about depression in children and what causes it. How can we differentiate it from just sadness? The most important thing is to recognize depression. It's quite prevalent. Anywhere from 15 to 16% of children have depression, and 57% of learning disabled children have depression. So it's important to understand that children can have depression, and it's not just the carefree time in childhood. But then how do you differentiate it from the feelings of sadness which many children will naturally and normally experience? The sadness that children feel is usually temporary, but in a depression or depressive disorder, apart from sadness, there may be reduced motivation and interest in activities, in academic work, in making friends, in going out. Or there may be recurrent physical problems like stomach aches, headaches, the child is clingy or upset, and of course there are sleep problems. Now, depression is hard to recognize in children because it does not necessarily present like the way it does in adults. And this is because the child is developing. The way it presents in different age groups is different. For example, an infant may be passive or unresponsive. Babies left in the orphanage they don't gain weight. It's called failure to thrive, or they don't develop their milestones as other babies do. They may cry excessively, or more often they are passive and may have sleep problems. A preschool child, that is a child below 6 years, may be withdrawn, inhibited. It may be clingy, like the child may cling to the parent or whine or constant, that natural joyfulness you see in children this age may be absent. A child who's school-aged may actually become argumentative and combative. They fight, they are disruptive, they get into fights in the classroom, they may have tantrums, their academic performance starts to deteriorate, they may have difficulty making friends. Of course, they may also be tearful, withdrawn, and cry a lot. A teenager may feel guilty, hopeless, they may feel misunderstood. A teenager who sulks, doesn't join in family get-togethers, is locked up in his or her room just playing on the computer, possibly be depressed. So what causes depression in children? One of the main things is loss of a loved one. Now this could be either because a parent has died, or there's divorce parents, or the child has relocated and lost his friends or extended family. So this can cause depression in children. Insecure attachment to parents, particularly if the parent himself or herself is depressed, there is a lot of family conflict. 30 to 45% have genetic predisposition, and it may run in families, the chances of being depressed. There are children who are more their sensitivity is heightened to stress, so they feel stressed more easily. They're usually associated with anxiety, and they can also develop depression. Problems in family and interpersonal relationship. I knew of a child whose friend had rejected her. The whole group decided that she wasn't cool enough, and they rejected her, and she went into depression. Stressful life events, particularly relocation, change in school, academic failure, all this can result in depression. What happens is the child cannot regulate their thinking, their negative mood, and they have distorted thinking. It's all or none. They don't see the positives in their life. They only focus on their negatives. They start feeling hopeless. They also feel responsible for anything bad that happens, and they may develop what we call ANTs, or automatic negative thoughts. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.